Does anybody have any comments or questions about the performance package for last month? Well, I'd like to ask a question then. In the summary paper to the board scorecard, Trevor, you say that under Great Place to Work, which is the third paragraph, that staff sickness increased. And that, I think, is not what was said in the staff sickness paper, where it said that it had fallen sharply. So could we just clarify or correct that point on the front sheet? So we haven't got Roger with us. Renette, are you able to clarify
It did go down in January, but I wonder whether the increase is a year-on-year increase. So it's slightly higher than the previous year.
Chairman, the scorecard metric is a 12-month rolling figure, and I think that's where the difference lies, but we will make sure that's clarified and sent round to board members.
Yeah. But it definitely decreased sharply in the month.
Okay, thank you.
In December.
That's reassuring. I was also perplexed. I'm convinced there's an explanation for this, but I just couldn't quite get my brain around the second bullet point on the summary paper, that the volume of contacts was below contracted level, and yet we're still not meeting access targets. Is that's a staffing, resourcing issue? Yeah.
To answer that, so it's a staffing issue which is pertinent to particular times of the week and particular times of the day. Yeah. So it's linked very much as per the performance improvement plan about getting a better balance between when our staff are available for our patients and when our patients' demand is. So we're getting a situation whereby we've got more capacity during the day and insufficient at the evenings. And because it's a percentage of the total contacts, then if the calls don't come during the day, which they are less now, and they do come at the evenings and the weekends, then that causes the big difference that we've seen there.
Thank you, Annette. And it's because of that mismatch that we've been asking our staff to give us more resource outside of the 9 to 5 weekday period.
Absolutely,
which you've done recently, and I wondered if you might like to tell the board about that.
Sure. So it's captured in the board report in terms of the performance improvement plan, but we are in the process of discussing with our staff moving everybody, whether they are full or part-time, to work a minimum of 5 in 8 weekends. So at the moment there is a sliding scale which is prorated down. So if you work part-time, then you work less than 5 in 8 weekends. And if you work full-time, then you do work 5 and 8 weekends. Some people, subject to the roster option they chose, work 8 and 8 weekends.
Yeah,
so we do have it's a minimum of. So we have, in discussion with the unions, we have entered into discussions that will be handled by individual team managers with individuals to take into consideration their personal circumstances as to how quickly this change is implemented. But we are seeking over the next few months to move everybody in the organisation to 5 weekend shifts in 8.
Okay. Thank you for that. I mean, that's clearly significant for our staff. I think it's worth the board noting that this is a big ask for staff, but it's clear from our performance package, the information that you've given us, why that's necessary. Absolutely. In order to deliver the service that our users and our commissioners need. So I think it's important that the link is made between this significant additional ask that we're making of staff and the absolute necessity for doing that, which is about sustaining performance when people need us.
Absolutely. And I think that what we're also what we've been seeing, and what we will see more of as 111 rolls out, is that 111 is predominantly an out of hours weekend service.
Yeah.
Much more so than the 0845 currently is, and the 0845 service itself is becoming more predominantly out of hours and a weekend service. So this where we are now might be not necessarily where we are in a year or 2 years' time as 111 is rolled out further. But we absolutely do understand that this affects people's lives quite fundamentally.
Yeah.
And it's not a decision that we took lightly.
Right. Okay, thank you for that. Tim?
Thank you. Just on the subject of overtime, I mean, and it's got to be managed locally, because you can't do it any other way, but I assume we've issued some guidelines that, sometimes you get in a bad position with overtime where certain individuals are doing far too much, and then you get so have we issued some guidelines to be applied locally on how to use overtime? Okay, so
absolutely.
I don't need to know what they are.
We have national policy around overtime working, right. And we try, obviously, to stay within the working time directives, but we also have local discretion at a manager's discretion in terms.
And you and Roger see a report about that, do you?
Could you speak up, Tim?
Yeah, sorry, you and Roger see a report about that.
I see a report every week about. I'm assuming
Excellent.
Roger does. But
okay.
I definitely see a report every week about what the proportion of overtime.
Thanks. So we're not going to get into a situation where certain individuals are doing too much overtime. I know.
I don't see a report at an individual level, but I see it at an aggregate level. But I know that report at individual level is made available to team managers in terms of the discussions with staff.
Excellent.
Okay, thank you. Trevor, do you want to talk separately about the finances or just take questions? I can see some questions about that.
Happy to take questions. The detail of the report will also be discussed at next week's Finance Committee.
Okay. So are there any more questions on operational performance before we move to finance? Yes, two. Okay. Tim, then Sue.
My question relates to the access again and the explanation that we give in part that there's been a change in the case mix and that we have more urgent and less urgent as opposed to non-urgent calls. Do we have a handle on whether that is because there's a genuine change in need out there, or does this represent some promotion that we're putting forward, or perhaps does it represent greater caution amongst the staff, our frontline staff, as to how they assign calls? And if so, is there a need to review the CSPT or training or general performance in that sense? Because clearly if staff are erring on the side of caution, it will skew then what happens to performance, particularly to the non-urgent calls and callbacks.
Trish, do you want to come back on that?
Yes, we have reviewed the data over the Christmas and the New Year period, and what we have identified is there's been an increase in the more urgent requirements of patients with the cold and flu type symptoms, breathing difficulties, coughs, some increase in chest pains. So we actually believe the increase in the case mix is reflective of the patients ringing the service and the symptoms they're experiencing. We had data regarding the P1 calls that were experienced over the Christmas, and our staff were requested to review those calls in order to assure that the priority assigned to them was appropriate. So that was further evidence of the data we'd received, which indicated that our case mix has had a shift to a more urgent requirement. And we also believe that's because patients are self-serving with the health and symptom checkers, so the more urgent patients are actually picking up the phone to speak to a clinician or to a member of staff rather than self-service online.
Yeah. Okay, thank you. Sue?
It was back to the conversation we were just having about the team managers discussing work patterns on an individual basis with their team, and it just struck me how important that role is, and it's a new role. And I just wonder what the feedback was in terms of how that role has developed. Is it achieving what we wanted to do, which was to generate a greater team spirit, along with a whole lot of other things, but just generally, what's the feedback from that?
Yes, please.
I think it's the feedback generally is that they're very busy, as one could imagine. First of all, in taking over new members of teams that they've never worked with before. So that has been a bigger piece of work of getting around the large teams now that they're needing to focus on. There was a sort of gap over Christmas, of course, because they weren't able to get to know their staff because the staff were all too busy taking calls because of the excess demand that we had. We have had more time made available for one-on-one and also team meetings during January and February. They also are getting extra training and development that we are now rolling out for modules 3 and 4 of the Competent Manager programme, which is much more about increasing their skills of being able to bring around desirable performance changes and having a proper negotiation discussion with staff. So I think it's a little early to tell for all of them, but the feedback that I get from talking to team managers directly is that they are enjoying the role, they're enjoying the focus, and they are looking forward to being able to ramp up the performance that they know that they are able to achieve once they've got the time to do so.
Go on, Sue.
Yeah, just one question. When are we seeking formal feedback from our staff? We normally have an annual or
We've had the staff survey. We've just had that.
Okay. And did that include? Did it not pick it up?
I don't.
We're going to. So I don't know, but the answer to that. We're going to have a seminar on the staff survey results and a board item in that order, so that we can come to the board with an action plan.
Yeah.
I would like to suggest, and I've been thinking about this because my thoughts are very similar to yours, Sue, about the centrality of the team leader role, is that we might consider having another offline board seminar when you think the time's right, Renette, to talk specifically about team development, so that we can understand what's the span of control like, how is a team leader's time spent over a month, let's say, what the feedback is, and because I think that as we move towards an organisation where the basic engine of the whole organisation becomes that team, we need to understand how it's working, and we need to, So that's a suggestion of mine that we would do outside of the board, but for board members, when we are in a position to understand. Bless you.
Okay.
Just to add to that, John, we need to do that. But I was horrified looking in my diary that we have very late Easter and royal wedding in the same week. And so there's going to be
bank holidays.
So it's got a huge challenge for the organisation. So we need to have that feedback in time, maybe, to make any adjustments that we might need to make to get through
I
that
suspect
period.
that
Isn't that long enough?
To do that.
One of the although we want to have an performance improvement on every single day of every single month, not just at Easter, and the royal wedding with the bank holiday. So we've got 2 4-day weekends coming up.
Adjacent to each other.
And what we're not clear of about at the moment is whether normal service will be resumed in between, or whether some services might not be available in that long period. However, so although, as I say, we want to meet the targets every day, we do have a subset of the senior ops management team who are looking specifically at Easter and bank holiday planning.
Thank you for that.
I'm sure that's necessary. I'm sure it's your big headache coming up.
Yes.
Trevor, then Louisa.
I think it is important that we have a board discussion about the new management arrangements. But I think before we do that, it's important that we get views from staff directly. It was a big issue during the consultation process, some concerns around what the new management arrangements might be. Certainly when Alan and I visited Bristol, that was a significant issue they wanted to talk to us about. So I would hope there's a very large staff input into that discussion.
Yes, good. Thank you for that. I was thinking we probably want some staff participating as well, but your point is also broader than that.